Hi, my name is Dr. Michael Veselak. I'm a chiropractor in Camarillo, California, and we work at Camarillo Functional Health. I'm board certified in integrative medicine, and I'm a certified functional medicine practitioner. Today we're going to talk about is autoimmunity and the three pillars of autoimmunity. The first pillar that a patient must have to be autoimmune is they must have a genetic predisposition. We learned from the Human Genome Project that generally it's more than one gene that express themselves when a patient becomes autoimmune. We also learned from the Human Genome Project that most genetic issues are related to environmental issues or epigenetics rather than genes itself. And finally, not all genes that have a mutation will turn on. We have the ability to express genes on and or off depending on our lifestyle. We utilize a lab called 23andMe that does genetic testing. We take a look at the different mutations that a patient can have as well as the SNPs, and it helps us discover what the best route is through food or lifestyle changes to help this patient to recover and put their symptoms into a remissive state. So the second pillar that a patient must have if they're autoimmune is there must be some environmental trigger. This can be several different things. It could be heavy metal, chemical, bacterial, parasitic, molds, Lyme, sometimes food sensitivities such as gluten, dairy, soy, or nightshades can create the trigger. And so it's our objective in this office to, again, cause these symptoms to become less pronounced and try to reverse them altogether, is eliminate the trigger and thereby eliminating the symptoms of the autoimmunity. We do tests in our office to kind of determine what those triggers might be, because there could be a wide range of these various triggers. We'll do heavy metal testing through urine. We'll do stool testing so we can see if the issue is a fungal, parasitic, or bacterial problem. Sometimes we'll do a breath test for H. pylori or SIBO, which is a small intestine bacterial overgrowth. We run the basic CBC so we can look at the white blood cell count and the various components of it, as well as the complete metabolic panel. We like to run tests in our office so we can actually really get down to the cause of what the issue is for this particular patient. And the third and final pillar of autoimmunity is intestinal permeability. So again, you must have all three of these to become autoimmune: the genetic predisposition, some environmental trigger, and then intestinal permeability. So what the permeability does, it allows these foreign bodies to actually invade our body and expose our immune system so it's constantly under attack. Leaky gut, I'm sure you've heard that term, is when the tight junctions in the stomach mucosa becomes a little bit more permeable, and these proteins will circulate our bloodstream, and again our body will interpret these as a foreign invader. There's often a crosstalk between these cells of the mucosa, and this has to do with occludin and zonulin, and so we like to test for this to see if it's actually a problem, to see if there's a miscommunication, to see if the cell wall is permeable. So we like the Cyrex labs. Array 2 helps us test for leaky gut. Array number 3, we test for various gluten molecules. There's about 18 total that we test for, as well as to see if the patient is autoimmune to the skin, gut, or nervous system. And then finally we'll run Array 4, which tests for a cross-reactivity. We have some patients that are gluten sensitive and they restrict gluten from the diet and they're still having symptoms, and unfortunately there's about 18 potential foods that can cross-react with gluten. So we like to test for this so we can eliminate those foods right off the bat. So it's very important in autoimmunity that you fix the three pillars: genetic, environmental, and or leaky gut. For us, the most easy one to fix is the leaky gut. And you only have to fix one of these pillars for a reversal of those symptoms or a reduction of the symptoms. Now, the only time when we actually will go after the environmental trigger is with celiac disease. Then we'll actually remove the gluten and it makes it then easier for the patient to respond. So in our office, we do something called bioresonance testing. It allows us to go deeper in the body so we can actually look at the chemical or heavy metal toxicity. Sometimes the lab tests for heavy metal and or let's say Lyme's tests, it's just not so sensitive. I mean, the success rate might be 50%. So we've learned another tool that we have found to be quite effective in really identifying the toxin and then help us to eliminate that particular toxin within the patient's body. Thank you so much for listening. Hi, my name is Dr. Michael Veselak. I'm board certified in integrative medicine and I'm a certified functional medicine practitioner. I practice in Camarillo, California at Camarillo Functional Health, and today our topic is going to be the adrenal glands. So the adrenal glands are commonly ignored in modern medicine even though they're extremely important. They sit just above the kidney and they produce a lot of hormones. The two that we're really going to focus on today are DHEA and cortisol. So cortisol is one of the major players in autoimmunity. When the body's under chronic stress or stress at all, it releases cortisol. And when the stress does become chronic, cortisol eventually becomes extremely inflammatory to the body and actually to the brain. So it's interesting because it actually plays a dual role. It actually will protect us. Its job is to be a modulator of the immune system, and that's when we're under certain stress. When that stress does become chronic, the cortisol will end up harming us and actually leading to the autoimmunity. So it is one of the major players in inflammation. So as I said, it acts as an immunomodulator, and it will help us build parts of our weakened immune system, and it will also handle our day-to-day management of stress. And that's really where we get into trouble, is these days many of us are under too much stress, either from emotional or pretty much the toxic soup we live in, exposure to the chemicals and heavy metals and all our food sensitivities that we have. So there's a lot of reasons why so many of us are having little issues, and my practice is now probably 1 out of 3 patients are struggling with some autoimmune issue due to all the little factors listed here: the emotional, physical, chemical, viral, bacterial, fungal, and all the toxins from the environment and dietary stress that we're exposed to on a daily basis. So this chronic elevation causes a taxing of the adrenal system and a release of an excessive amount of cortisol. So eventually this chronic state will weaken our mucosa, the digestive tract. Now this is an issue because 80% of our immune system lines that mucosa. So if we have damage of the mucosa, our body really can't fight the fight, and then it leads us to greater exposure and maybe autoimmune issues down the road. So when the mucosa becomes irritated, it will eventually become permeable, and then that leaky gut situation will occur where the protein molecules will, instead of going downstream, will actually circulate through our body, and our body will recognize these as a foreign invader and actually attack it. So it can set up a whole cascade of immune responses through our body. It's been well documented that gluten sensitivity and gluten molecules can react with the thyroid gland and lead to conditions such as Hashimoto's disease. So patients often ask, well, what came first? Was it the damaged mucosa or was it the infection? And really it can go both ways. You can have an exposure to an infection like a parasite or a fungus or a bacteria that can actually cause a weakening of that mucosa, or you can have chronic stress and the cortisol levels, which will weaken that mucosa, which will eventually lead to a chronic infection. So it really does go both ways. So as a functional medicine practitioner, it's my job to figure out the cause, the root cause, and start to heal the body and not just chase the symptoms. So that's basically the definition of functional medicine, is we get to the root cause of the problem and not just go symptom after symptom and don't label with a certain diagnosis. We just look at the roadmap of the body and try to heal it. So in our office, the basic tenet is you must heal the gut. as I stated, the gut is where 80% of the immune system is. So if the gut is not healthy, the body just can't fight the fight. So things that we recommend are certain dietary changes, lifestyle changes, and supplementation if needed. So the next line of defense is when our patients come, a lot of them have multiple issues. So sometimes we have to give adrenal support, liver support, thyroid support, sometimes help balance out the hormones. Again, we're looking at the cause so we can support the body so the body can actually heal itself. So we focus on a couple pathways, the digestive pathway, the elimination pathway, and of course the hormonals and the thyroid. So it's very important for us to look at the body and discover what pathogens are creating the inflammation. So if it's chemical toxicity, heavy metals, bacteria, fungal, parasitic. So we do testing to determine what is that toxicity. We'll run lab tests, sometimes urine tests, and sometimes we'll do a type of test in our office we call it bioresonance testing to get really deep into the layers of the toxicity to help remove them. So some of the symptoms of adrenal fatigue are, number one is fatigue, being overweight. Sometimes depression or anxiety can be associated with adrenal fatigue. Female hormone issues are common, such as hot flashes or night sweats and or mood swings. And there can even be digestive problems. That's fairly common. So in our office, we like to recommend certain nutritional or nutraceutical products. The adaptogens are, we'll test for those, see if the patient requires them. Ginseng is good, rhodiola. We like ashwagandha, the herb, to help calm the HPA axis. Pantothenic acid, vitamin C, calcium, magnesium, and we'll usually recommend maybe B6. Now, for every patient, we don't give all these supplements. We figure out what the patient needs and we'll supplement appropriately. So there has to be lifestyle changes also. So depending on what stage of adrenal fatigue, rest and sleep is extremely important. So it's really important for the body and our circadian rhythm to get our 8 hours a night. It's important to exercise on a daily basis and not really to over-exercise. Sometimes over-exercise can be the cause of the chronic stress. There has to be dietary restrictions, meditation or spiritual belief, and then we recommend a belly-type breathing to kind of help to balance the parasympathetic, the vagal nerve, and the sympathetic nervous system out. You might have heard this term before. It's called pregnenolone steal. And pregnenolone is a precursor to cortisol as well as to some of the sex hormones. And what happens is when pregnenolone basically has a choice, is it going to become a precursor to the cortisol, which is our stress hormone. So it's kind of when the body is in fight or flight, it's always going to choose cortisol. And the sex hormones, estrogen, testosterone, estradiol, are going to suffer accordingly. So it's important to look at that pathway, DHEA, cortisol, testosterone, estradiol, estrogen, pregnenolone, to see if the pregnenolone steal is actually taking place. So in our office, we'll actually test for adrenal fatigue. We recommend a saliva test because blood tests just really don't show the complete function of the adrenal gland. And what you'll do is you'll give a saliva sample 4 different times a day so we can actually measure your hippocampal rhythm, your level of cortisol as it relates to melatonin, which is your sleep. So ideally, when you wake up in the morning, your cortisol level should be high and it should slowly decline at night. And then melatonin, it should be an inverse relationship. The melatonin should be high at night, so when it's bedtime, we fall asleep. But so often we have patients these days that they wake up, they're tired, they go to sleep, and they just can't get to sleep. Their body's all wound up still, and they're wondering how they could be so exhausted in a night's sleep. Well, their basic circadian rhythm, the hippocampal rhythm, is just not functioning properly. So we like to do the saliva test just so we can see what stage of adrenal fatigue or burnout the patient is in. So basically prognosis, the adrenal glands take a while to heal. So if you're in stage 1, it takes about 6 months. Stage 2 is between 6 months and a year, and stage 3 can be a year and slightly thereafter. And that's with support, supplementation, good lifestyle habits and patterns. So I'd like to thank you so much for listening to this little webinar on adrenals, and if you have any questions, you feel free to ask me. My email is dr.veselak@gmail.com, and if you have any interest in coming to our clinic, the phone number is 482-0723. Thank you so much. Hi, my name is Dr. Michael Veselak, and I'm board certified in integrative medicine and a certified functional medicine practitioner. Today we're going to talk to you about reducing inflammation in the central nervous system, and particularly the T-reg cells, which are the modulators of this. So the T-reg cells' job basically is to make sure that inflammation is exactly where we need it and when we need it, and not too much if we do not need it. So its job is just to regulate inflammation and keep it under control. So occasionally with an autoimmune patient, the inflammation gets stuck and the T-reg cells kind of get stuck in a particular pattern, and they don't quite regulate or modulate what's supposed to go on. So it's very important that we support the T-reg cells. Some of the supplements that actually support the T-reg cells are vitamin D, glutathione, selenium, iron, iodine, calcium, curcumin, and butyrate. So we'll oftentimes recommend taking these supplements depending on what your lab levels or how you test in our office. So for vitamin D, we like to see our patients at a 50 to 65 optimum level. If you take too much vitamin D, it can actually become toxic. So we like to have you take that with vitamin A and vitamin K to reduce and eliminate those potential side effects. So most of our patients these days test for very low in vitamin D, which is indicative of chronic inflammation and infection. Glutathione is another very important supplement that we like to give to regulate the T-reg cells. So it's the most powerful antioxidant in the body. For a long time, we didn't really know how to supplement with it. There was no pills or no creams. They're now coming out with various glutathione pills and creams. We like the liposomal version. We think the body absorbs it a little bit better. So in the past, people would take alpha-lipoic acid and or NAC, which are precursors of glutathione. We like to go right for the source for the glutathione itself. It's very important. Selenium, iodine, zinc are at good levels in the body, along with iron for T-reg cell function. So here's some good sources of selenium that are whole foods. You can get it through cold water fish, Brazil nuts. For iodine, we like kelp flakes or nori chips. Sea vegetables are very good. And zinc, just good old red meat and shellfish will give you good forms of zinc. If you do it through the whole foods, that's better. If you need a supplement, we'll supplement you through these various selenium, iodine, and zinc. So what we'll do in our office is we'll actually do a zinc taste test to see if our patients are don't have enough zinc in their body. So basically we'll give them a liquid form of zinc, and if they take that, they should taste a metallic taste almost immediately. If it's a delayed reaction or no taste at all, it means they're deficient in zinc. There hasn't really been a lot of research on this particular test, but in the functional medicine world, it's kind of out there, and people use it in their office just as a good preliminary screening. So with iodine, there is some controversy, and you need to be aware of this, because if you have Hashimoto's or Graves', do not supplement with iodine. It's been said that it's basically adding fuel to the fire. So instead, take a small amount of sea veggies, perhaps 1 milligram a day to get the iodine that way, and that'll reduce your risk of any flare-ups of your autoimmune issue. So probiotics are also really great to help with T cell regulation. So the bacillus type of probiotic is in particular the important one. This is a soil-based organism, and it's butyrate is a very powerful T cell regulator. This is part of our healthy bacteria that we can actually get through sweet potatoes, bananas, leeks, onion, garlic, and Jerusalem artichoke is another food that we can get the butyrate from. And if we actually feel that a patient is deficient in this type of gut bacteria, we will actually run an organic acids test to measure the levels of butyrate in the body. Vitamin A is another very important supplement for T cell regulation, in the form of retinol, not beta carotene. It's found in all animal foods and dairy products. You can get it through your foods. And organ meats, especially the liver, is very high in vitamin A. So basically, if you want to reduce central nervous system inflammation, things that you must do is adopt an autoimmune diet. Take omega-3 in the form of EPA and DHA. Cod liver oil is recommended. Curcumin is great. Pre and probiotics. You must get 8 hours sleep a night, exercise on a regular basis, and don't overexercise, and then stress management. These are the tools that we use to reduce the inflammation along with the T cell regulation, the various supplements that we talked about. Thank you so much. And if you have any questions, feel free to email me at dr.veselak@gmail.com, or you can call me at area code 805-482-0723 to schedule an appointment. Thank you so much.